A new CDC study shows children make up less than 2% of confirmed COVID-19 cases in the United States. It also suggests they're not as severely affected as adults. But there's some evidence of unusual warning signs in children. The head of emergency medicine at Dell Children's Medical Center explained to our Sally Hernandez what he's seeing. He says he's actually worried most about what he's not seeing.
And what can you tell me about some reports that an early sign of infection in kids may actually be what's described as COVID toes? That's a burning sensation with purple and blue blisters.
I've been reading about that literally over the last 12 to 18 hours. And so far, we are not sure what that is. But it has been something that's been seen in the New York City experience and on the West Coast experience. The other thing some people will talk about is the COVID eyes, where people will get sort of an inflammation of their eyelids.
And what have you seen over at Dell Children's Medical Center? Any positive tests?
I've seen one child that tested positive in the community and then came in for some fever. They were fine and we sent them home. We've had one other younger child that tested positive and they went home after 2 days.
Wow, well, that is some good news.
What I'm worried about is, we're seeing less people than we normally do this time of year.
So normally, what kind of illnesses would you see in April or in May that you're not seeing kids go to the doctor for?
Upper respiratory and fever type illnesses. So we have seen a decrease in those. I worry that maybe people are letting conditions get worse than they should be before coming in. So if you have concerns, talk to your pediatrician, talk to your physician.
And we know most states aren't taking chances and won't reopen campuses for the remainder of the school year. Only 7 states are allowing schools to open their doors this semester. Here are 6 of them: Kentucky, Maine, Idaho, South Dakota, California, and Tennessee. The 7th state, Montana, is actually giving school districts the option to begin in-classroom learning as early as next Thursday.